Hello, everyone. Today, I'm going to share some insights into the communication tools that you need to succeed as a clinician in primary care. Bear in mind that this is a very basic type of communication skills that if you begin to use in your conversation with patients at this level, you might be able to achieve some degree of what we call active listening skills. And I believe this is one of the most important skills you need in your clinic setting. The reason is because the balance between the patient and the doctor in the primary care clinic should be at the same level. In as much as the patient is coming to seek health advice or treatment from you, your role is to be a health concierge. You've got your extensive training, you've got your guidelines and protocols to guide the patient, but you need to have a way to make your skills tailored in your communication with the patient. Because most people would forget what you did for them, but they would hardly forget how you made them feel. So the good news for you is you don't have to learn a huge variety of communication skills to succeed. I believe that if you master a short list of tools that I'm going to share with you today, you will be able to produce a conversation between you and your patients that would be effective and have a natural flow that would achieve the outcome that the patient has come to seek your professional advice on. So let's get right into it. What are these communication tools? There are about 5 of these communication tools, and one of them is using mirrors and labels to facilitate conversation. The second is using statements to ask questions to clarify the ideas, concerns, and expectations of the patient and the impact of the condition. The third one is using presuppositions and scenarios to pivot to sensitive issues or when you want to give options. The fourth skill is summarize. We'll show you how to summarize. And the fifth skill, slightly nuanced, but it's how to ask what are you thinking at this point questions. These are the 5 tools that when used consistently in a conversation, you are likely to achieve a conversational consultation. Now, part of your consultation will involve other type of questions that you can ask, but this would depend on the type of case that is coming to you at every given point in time. For example, if you're asking questions to explore onset of symptoms or red flags or differential diagnosis and treatment options, these type of questions come from your extensive training or guidelines or the protocols that you already know about. Don't worry about these ones for now. You have already spent a lot of time learning about these diseases and the pathways. I overheard a conversation between an entrepreneur and a client who was seeming hesitant to value the service that was being provided to the client. So this is a scenario whereby the client was asking for a first-time buyer discount. There was an awkward silence that ensued between the entrepreneur and the client, and to diffuse that, the entrepreneur replied, "It sounds like you feel that my price is too high." And immediately it was like the client's mind was read aloud, and it diffused that stalemate immediately. And then they were able to now talk out what the barriers were, and in the end it was a win-win situation. In that instant, the client felt understood and settled for the offered price. I think this is the type of scenario that makes you want to understand how to communicate effectively and get your counterpart or your patient telling their story much more effectively so that you can be able to help them in the best way you can. So that question comes, can we use these skills in a clinical setting? And the answer is yes. We can apply these communication tools to any situation. I have used them in turning my daily communication and consultations into meaningful conversations that have resulted in joint management plans that met my patients' needs. Chris Voss, he is the founder and CEO of the Black Swan Group. He was a former FBI negotiator. He wrote a book called Never Split the Difference. What stood out to me in this book was that he summarized his strategy, which he called tactical empathy. This was because he saw empathy as a mental hack based on the factual evidence of the neuroscience of how we interact with each other when we communicate. And the aim is to demonstrate empathy consistently and effectively to be able to achieve the best outcome for the person you're communicating with. And with this strategy, in this case, in our case, the scenario will be a patient is at the center of telling their own story, and they should be encouraged to tell it in a way that we can then use what they've told us to offer them solutions that are available, or at least help them to make decisions about what matters to them. I'm going to share some dialogue between a doctor and a patient, and I'll use those examples to show you how some of these communication tools are used, and you can begin to take them into your own consultation room. So the first communication tool we're going to explore is called mirrors and labels, and we use this to facilitate a conversation. So here's a sample conversation. Doctor, how can I help you this afternoon? Patient, I used to suffer with ear infection as a child, and the last few days, my ear is blocked. I can't hear very much out of it, so I think I have developed an infection there. The doctor, blocked ears? Patient, yes, just the one, the right one. I'll pause for a second. You can see from this example, the doctor mirrored a key word that he needed the patient to clarify, where exactly the patient felt there was an infection, and right on cue, the patient elaborated on it. This happens all the time. Let's look at another example. I'd like an x-ray of my shoulder and of my ribs just to check that it's just a bruising and not something like a crack, something more onerous than that. Doctor, something more onerous? Yes, I'm not sure if I've damaged something like my lungs. Doctor replies, it sounds like you are worried about a serious injury since you fell, and you would want to be fully reassured in some sense. And the patient replied, that's right. Again, picture the way the doctor was able to characterize the concern of the patient in the conversation and use the mini summary to capture the essence of why the patient wanted an x-ray, rightly or wrongly. That's for them to decide in the next part of the conversation. Well, you can see that these two examples are highlighting the importance of mirroring the patient's conversation and using the key words with some form of upward or downward inflection, and labeling the comments prefixed with it looks like, it sounds like, it seems like, to be able to identify the reasoning behind the comments the patients have made to you. Let's try another example. Doctor, how can I help you today? Patient, I'm really struggling with my sleep a lot lately, and my mental health has taken a bit of a nosedive as well. I don't know what to do. Doctor, your mental health has taken a nosedive? Yeah, I think it's just stress, and I'm not coping very well in general. In general? Like work stuff. The doctor replies, it sounds like you're having some difficulty at work, or is there something else going on? Not really, but it's stressful. I work as a supervisor and a lot of responsibility lies on me. You're in charge? Yeah, my colleagues say I look exhausted and I'm not reacting in my usual friendly way. Again, you can see the doctor mirroring the comments of the patient to allow him to express much more deeply areas of concern and interest to him, making his story flow very naturally in a conversational manner. I hope these examples are helping you to identify what a mirror is and what a label is and how to use them in a conversation to achieve a good flow. Let's go to the second tool. Using statements of emotion or questions to clarify the ideas, concerns, and expectations of the patient and the impact of the condition. Here are some examples. Doctor, how can I help you today? Patient, about 8 months now. I'm going a lot in the night, about 5 times. I've seen a program on the tele during the week. I wondered if I needed to be checked out. Doctor, you sound really worried. Patient, yes doctor, I want to check it out before it's too late, but it might not be that, I don't know. Doctor, it sounds like this TV program was warning people with urine problems about prostate cancer and you were hoping to be checked out just to make sure? Patient replies, that's right. In this example, you can see that the doctor was able to verbalize the emotion of concern of the patient and reflect their expectation. There was a joint agreement that the main idea of what may be causing him to go to urinate about 5 times at night might be related to prostate cancer. In that way, the conversation can now move further by exploring if this patient indeed has symptoms that are consistent with prostate cancer and may culminate in the patient coming in to have an exam or having further blood tests to find out if his concern is genuine or if he can be reassured. This is the beauty of using good communication tools to elicit concern, ideas, and expectations from a patient. You can see the mixture of a label and a mini summary in this scenario because the patient has already offered his expectation. If this was not the case, a simple question, for example, with regards to your concern, was there anything in particular you hoped should be done in a situation like this? Or you can say, I've got some ideas of what we should do to help, but I wondered if you had any thoughts of your own. Overall, you can see empathy being shown throughout the conversation. Let's look at another example. Doctor, you said your hearing was not very good. How are you coping? In this example, we're checking impact. And the patient replies, everything sounds off. Sometimes I lose my balance when I'm walking around. In this example, you can see that the doctor mentions the symptom before asking how it's impacting their daily activities. This helps the patient connect the question properly, and you can see the natural flow in shows afterwards. In these two examples, we've been able to cover how to ask ideas, concerns, and expectation questions as well as impact questions. These are the ingredients that you need at the end of a consultation to formulate a management plan. Very crucial. Let's move on to the third example. How to use presuppositions and scenarios to pivot to sensitive issues or give options. This is famously called my friend John scenarios. Let's look at some examples. Patient, I have a chest infection. Doctor, when people have chest symptoms, we do like to check other factors that may make them at risk of infection, like smoking. Does that apply to you? In this example, you can see that the doctor was very sensitive about asking a question about smoking, and he gave the right context by using that third person presupposition here. This allowed the patient to respond positively or negatively depending on whether the situation applies to him or not. Let's look at another example. This is a mental health case. Sometimes when people are really down, they may also think of very dark thoughts like not wanting to be here or thoughts of harming themselves or others. Does that apply to you? Again, this is another example of presupposition. And the patient now replied, "To be honest, I've often asked myself, what's the point?" As you can see in this example, the doctor was able to calmly ask about a sensitive, uncomfortable topic, suicide, in a patient presenting with mental health symptoms. So far we've covered 3 tools. 1, mirrors and labels. 2, asking the right questions to elicit ideas, concerns and expectations and impact. 3, using my friend John presuppositions. The 4th tool we're going to share with you today is Summarise. Summary is absolutely necessary in your consultation. You may have to use summary early on, usually about a minute or 2 after a patient has expressed their ideas, concerns and expectations, especially if the patient offered all this upfront before you decide to go into the impact or the reason why they consulted you. However, in a GP consultation or in a primary care consultation, summaries are mainly important before discussing diagnosis and management plan with the patient. I'll give you some examples. The doctor is summarizing now. Doctor, right. Thank you for telling me all of this. I'll summarize just to check that I've gotten you right so far. In the last few weeks, you've been having tummy pains with difficulty swallowing, in addition to losing weight. You were worried about something sinister and you were keen to get some advice today. The patient replies, "That's right, that's right." A good summary almost always elicits a "that's right" response from a patient. Let's look at another example. Doctor is speaking now. Just to summarize what I've heard so far, it sounds like you have a stressful job and your mood is a bit low, which is having a massive effect on your ability to get a refreshing sleep, leaving you in a state of stress. You know you are not engaging in your usual calming activities like walking your dog. That's why you were asking about different medications to sort of combat the depressive feelings you've been having these few months. The patient replies, yeah, that's right. We all want to get the patient to that point of saying, "That's right," because at that point, you really have listened to the patient and you can move forward to the next part of your conversation. We're nearly at the end now. The 5th communication tool that I'm going to share with you is called asking the "what are you thinking at this point" question. This is a useful tool after you've given an explanation or shared a recommendation, or in a scenario where you've made a slightly prolonged statement. By asking "what are you thinking about this point" question, this will allow the patient to volunteer their internal dialogue that was going on while you were talking. It would also help you to explore more of what matters to the patient. That will prevent you from going off into your own agenda. I highly encourage you to ask or use "what are you thinking at this point" question instead of asking "do you understand?" Let's look at an example. Doctor speaking. I noted that your work plays a huge role in how stressed you feel. Sometimes people consider stepping away for a little bit, even for a week. Usually, you turn off work responsibilities to allow you to recover. What are you thinking at this point? Patient, I can try to speak to my manager about getting something like that, but I'll need a sick note. In this example, you can see that way the doctor framed the question at the end allowed the patient to verbalize their internal dialogue and gave the doctor a solution that he can provide to the patient and that suited the patient's needs. In this case, the patient had formulated a solution while the doctor was speaking, which included taking time off work, and the doctor should give him a sick note to cover him. What a brilliant way to end a mental health conversation. I hope these communication tools will come in handy in your clinic consultations to enable you to have a productive conversation with your patients. Practice them over and over again, and you find them as useful tools to enhance your empathy and leave a lasting impression with your patients. Subscribe to our channel for more educational videos like this. Thanks for watching. Bye now.